Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. The number of confirmed cases of COVID-19 in the nation continues to grow. In North Carolina, there are 298 reported cases in 45 counties. North Carolina is releasing statewide numbers of the tests being conducted. So far, North Carolina has administered 8,438 COVID-19 tests. This is not an inclusive number of every test that has been conducted in North Carolina, as hospitals and private labs are not required to report the number of tests. They are, however, required to report positive cases. Local public health departments are still being advised to adhere to the communicable disease guidelines and only release the amount of individuals in their particular county who have tested positive for the virus. Medical providers in Dare County continue to test patients who are symptomatic and meet criteria for testing, which includes fever of 100.4 or greater, cough, and symptoms of respiratory illness. We have not had any individuals test positive for COVID-19 in Dare County. When we do have a positive test result, we will share that information as soon as possible. I'd like to take a few minutes to explain how the public health system throughout the United States, North Carolina, and locally responds when a patient tests positive for COVID-19. At the local level, here is how the system works. When someone tests positive for COVID-19, they would be placed in isolation from others to minimize the spread of COVID-19. If the patient is experiencing mild to moderate symptoms, that isolation can occur at home. Our public health staff will then monitor the patient daily to keep track of their symptoms. Additionally, we will determine where the individual has been prior to being tested, who they were in contact with, and if they have any need for social support. We also then follow up with any of the direct contacts the patient has had and inform them that they are to quarantine for the next 14 days. I'd like to share a quote from a letter written by Vidant CEO Dr. Waldron and ECU Brody School of Medicine Vice Chancellor Dr. Stacy about COVID-19. This pandemic has turned into a wave that is rolling across our country, hitting our state and threatening our area. We can't stop this wave from hitting us, however, we can lessen its impact here. This quote caught my attention because each of us has a responsibility to act immediately and to take action to help our community respond to this crisis. It is everyone's responsibility to do what they can to lessen the impacts of COVID-19. Now more than ever, we need every person, organization, and government agency working together to protect our loved ones. Practice social distancing, stay at home as much as possible, call before visiting a healthcare facility, and respectfully encourage others through social media to do their part. These actions, combined with everyday hygiene habits like proper hand washing, coughing and sneezing into your elbow, and frequently cleaning surfaces, can help us flatten the curve and keep healthy. Now is the time to encourage sheltering in place. This means staying close to home as much as possible and only going out if absolutely necessary, such as buying groceries or picking up medications. This is the right thing to do to save lives and is the right thing to do for the long-term best interest of our community. As we move forward through this pandemic together, facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we receive it, and we encourage you to stay informed by visiting www.darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center at 252-475-5008. Thank you.